Hello and welcome to my video. My name is Deborah. I am 60 years old. I turned 60 in May of 2020. This is February 10th, 2021. And I just had my final visit with the plastic surgeon this morning. So those videos are out all the way at the end, but I'm going to take you through some before pictures, then after surgery, the day that I came home, that whole experience, how I felt, how I looked. I take you through some more pictures of me after surgery, the healing process, with makeup, without makeup, and finally the final interview that I had with the doctor this morning. There's two videos that we did this morning because we left out some information, and so we did a second one. Anyway, I hope that it's helpful. Hope you enjoy it. Please click on the like button and feel free to share. Hope you enjoy.
It's dry. It's the tubes. Hello.
Ew. Second day after I had my facelift. I have my eyes closed right now because I've got the gel in my eyes. The stitches that they put, I think it's just one stitch in each eye. It rubs on your eye and feels dry. So you can't keep your eyes open very long without having something moist in it. The eye drops for daytime sting a little bit, but the gel feels good. It helps moisten the stitches. It doesn't hurt per se. If you don't touch where the incision is, it does not hurt. But it's uncomfortable where these stitches are. It's extremely tight. If you've ever had a mud mask and left it on your face a really long time, that's how tight it feels. Very tight. And around my ears is where it kind of stings, where he made incisions. So if I don't take pain meds, the stinging is it's too uncomfortable. It's just enough that I can't fall asleep. So now on day 3 I just started taking Tylenol and one of my pain meds instead of both. I was taking the hydrocodone with the acetaminophen in it and another one which I can't think of the name of it. So I'm just down to taking the one and acetaminophen Tylenol. That seems to help. You have these women who say, oh, it didn't hurt at all. They must be on drugs because there's no way you can have a lower facelift and some eye surgery and that you don't have some pain. I mean, it's not unbearable. My tongue is red right here, so apparently the tube they put down my mouth either mashed my tongue into my teeth or I bit my tongue. I don't know what happened. It doesn't keep me from eating or anything. It's just a little numb.
feels like I bit my tongue. I'm able to turn my head about that far. And I've been sitting up mostly. I don't lay flat back on my back because I want to keep everything draining. I had the first dressing taken off yesterday afternoon, and my neck, he said, was not swollen. It looked really good. Everything looked great. He left the drains in over the weekend because he felt like I needed to keep it in a little bit longer. Under my eyes, it was purple, like dark purple. Now it's a violet color. My throat is sore from the tube being down my mouth and all the air and everything. When I chew, it does hurt. It feels sore because you're moving your mouth up and down and the stitches are pulling. So you have to chop your food up really small. I actually threw up after I woke up in recovery. And that's something I've never done when I've had surgery. They couldn't give me pain meds in recovery because I was throwing up. I had the nausea patch behind my arm. And apparently that and the Finagrin, something starts with an F for nausea, made me way too drowsy, so I had a very hard time waking up. In recovery, it was an hour and a half before they could get me to wake up, and even then I still could barely keep my eyes open. I could not walk without help. When I got home, my husband was trying to help me walk to the bathroom, and after I got out of the bathroom, I fainted. Of course, he was behind me holding me, so we both kind of went down together. So I threw up a few more times. Never took anything else for nausea. So I think it was last night I took the patch off because I had stopped throwing up. So I took it off and I actually started feeling better. I started feeling less groggy, less dizzy. Was able to walk around the house without help. So I had my surgery on Thursday. Today's Saturday, and it's 6 o'clock on Saturday. And I was just watching TV, and now my eyes are feeling really dry. But laying around is getting to be annoying. I'm not used to laying around that much, especially in one position. So I do try to get up and walk around as much as I can. So I've seen a couple of videos where women just say, it doesn't hurt at all. And I'm sorry, I don't get that. Unless they just didn't have as much work done. But I just had the lower facelift and neck lift. And then the eyes and little incisions on the side. Right there, and then I've got an incision. I don't know why they looped it right there. I don't understand what that's about. So I'll go on Monday and get this dressing taken off and get the drains taken off. And then Wednesday I'm getting the stitches taken out of my eyes, thank the Lord. I'm sick of that feeling. So after you have eye surgery, get someone to take a Q-tip or some gauze and moisten it. Clean your eyelashes. Get the blood off and the serum off. They will stick and stay closed, so you want to clean that off. Also, the round cold packs that they give you, I mean, they should give you one of those eye masks because that would lay on your eyes much better. I got the round ones, and you either have to hold them yourself, which you don't feel like doing that after you've had surgery, but my husband got these little clips. He he clipped them up on the gauze and then they hung down. But they still don't really stick in the right place. So they're almost useless. So we just took a bag of frozen blueberries and a little towel and put it across me and then put that on, and that felt better. You can brush your teeth, and you should brush your teeth. What else? So I'll do more videos later. Today is Monday. I just got the drains taken out. That hurt like HELL because pulling it out from behind my ear back here where it's really tender burned. It felt like I had taken a curling iron that was hot as hell and stuck it on the back of my ear for like a second. If you've ever done that to your head or anything, you know how hot that is. So pulling it out, like the tube was all the way down here. So I could feel it coming out, and it felt like an electric shock, you know, going through here. And then you could hear it. It sounded like a worm, pulling a worm out of something squishy, you know. It sounded squishy and just disgusting, wormy sound. And it just, when she first started pulling it, hurt like, And there was one over here, that one burned like hell. Like I said, it's like taking a hot poker and just touching the back of your ear. So my hair is matted down with, I guess, a mix of blood plus whatever solution they put on my hair. So it's pretty stiff back here. And she said I can take a shower in the morning after these holes close up. So I don't even know what that looks like. Let me see if I can get a good picture. Stitches right here, she said, was to get more lift on my face. That was something that he didn't discuss with me, which I don't mind, you know. Do what you got to do to, you know, make my face look good. But he had only discussed going around my ear and then coming up the back. But apparently he felt like he needed to do more. And this long stitch right here in the middle, the big one, she said that one is to hold my skin together. He actually had to take a section of my eyelid out. I guess it was too stretched out, whatever, too saggy. So he had to pull it together, and that's what that big stitch is doing. It's holding it together. I'll get the little stitches out all along here on Wednesday, and then this big one stays in for another week, and so do the stitches around my ear. Those are going to stay in another week. Thank goodness, because that's sore and I don't want them touching that. But this is disgusting. So I get to take a shower in the morning. I'm looking forward to that. My face looks a little more swollen over here than this side. I wonder if it's because of the jaw surgery. You know, I've already had drainage issues over here. This is underneath my chin, of course. It's all tight. Extremely tight right over here. Really, really tight. My face is numb. Glad I got the drains out and the gauze off. It's getting to be irritating. So, just wanted to show you that. shower this morning around 6 o'clock, and I thought the water was going to sting my incision sites, but it didn't. The only thing that was stinging was if I got water in my eyes, and that was just the most sensitive part. Of course, if I touched the area where the tubing was, drainage tubes were, that was a little sore, but water did not hurt any of these stitches. It took me quite a while to get the blood out of my hair and whatever else they used on my face that dripped into my hair. Need lots of moisturizer, especially if you have curly hair. Curly hair is more dry. And if you've had processed hair, of course, you want to put a lot of conditioner, leave-in conditioner on your hair. And then I just put it up in a ponytail bun to keep everything moisturized because it just feels like straw right now. But all these incision sites look cleaner. Looks better. Of course, I do feel better. But I'm wearing this headband to kind of keep things covered up. And I have a friend that I'm talking to on Marco Polo, so it kind of looks gross, and I keep it covered up. Still have swelling, mostly here on the right side, right here. And washing my face, you just want to pat your face, like pat the cleanser on your face, and then pat it off with a really moist washcloth or sponge. And then pat the moisturizer on your face. Your face is going to feel even more tight after you wash it. It feels like I've got a really super strong mask on my face, and that, you know how if you leave it on too long it starts pulling your skin? That's how this feels. And moisturizer does help it to feel better, but right now there's like a band from here going up like that that's super tight, and it's meant to be like that, but they say with time it'll relax. So my eyes do itch. They don't hurt like they did the first 3 days from the stitches that are in here. It's starting to feel better. So the gel that they give you to put in at night helps keep everything softer and less scratchy or whatever. But I do notice that I'm starting to, things itch, and I'm scratching my eyes more, rubbing them more. But I don't have a lot of bruising down here. They say it can go down in your chest. I don't have a lot of that. At least I don't right now. My throat's still a little sore from the tube being down my throat. Do have stitches up here, and that was for him to just do a little bit more on my cheek to bring that up. So he didn't do any lifting on my eyes up here. I didn't have a full facelift. This was just a lower facelift with blepharoplasty, I think that's what they call it, just the eye surgery where they bring the cheek up, bring up that ligament so that this is not sagging down low, and it made me look like I had dark circles. So, as far as how I feel, I'm able to walk around, do things. I drove myself to my appointment yesterday to get the drain tubes out, and I will drive myself tomorrow to get the stitches out of my eyes. Of course, she says this big stitch is not coming out until next week, as well as these around my ears are not coming out till next week. I think they're probably going to take this one out tomorrow. I'm totally off the prescription pain meds. Haven't had any. Don't think I took any yesterday. Haven't had any pain meds today. Just been using ice on my face. Now I'm able to lay back on one pillow. I have a cervical pillow that I'm able to just lay back on, and that feels a lot better and sleeping better that way. tried to sleep on my side, but my ears are still too sore. Can't do that quite yet. Regular diet. I really don't feel that hungry. I'm just doing smoothies in the morning and maybe half of a bagel. I did make some homemade hummus, and I'll dip some chips in that, but still, even the chips are still too hard for, chewing. Chewing still is an issue. Can't open my mouth much wider than that. That's about it. It's just so super tight right here. It feels funny, but it feels so much better to get the tubes out, to get those gone, because they cause, pressure in your head, the tubes smashing against the gauze that they had around my head, plus just touching it made it more sensitive. So that feels a lot better. I know when they get the stitches out of my eyes, that's going to feel better, because when I close my eyes, I can feel the sutures stabbing the top of my eyelid a little bit. So that's unpleasant. But I'm trying to think. I still take naps and rest whenever I feel like I need to. I'll sit in a chair outside with sunglasses on and a big hat on the back patio, sit in the shade just to get outside. I have had to lean over a couple of times, and it didn't hurt, but I try very hard not to lean over. I just stoop down when I have to pick something up off the floor. I know they don't want you leaning over the first week, so I'm trying to be careful about that. What else? Of course, they say your hair is kind of lifeless after you have surgery, so give it like 6 to 8 weeks to kind of straighten out. And I can see where that's true. My hair just was super dry, even after I put a ton of conditioner in it. It was just felt like straw. So I'll just have to give that some time. Maybe have to go to a professional to get a hair treatment or something, or maybe I can find something here at the house, but I really don't feel like doing that right now while I've got stitches in my head. So can't think of anything else other than, I guess, touching my face. There's certain places I can touch that are very, very tender that actually hurt, kind of burns a little bit if I touch it, and it's just the bruising areas where it was bruised. But that's about it. So hope that helps. So this is day 7, 1 week after surgery. The stitches are gone out of my lower eyelid except for the big one. That comes out on Monday. And then this will come out Monday. All the stitches around my ears will come out on Monday. A lot of the bruising has cleared up. Especially over here, it was more purple. For some reason, I could not sleep last night. Or my chin. Didn't sleep very well last night, but I feel the swelling has gone down a lot more in my eyes, and I can blink and squint just a little bit. It's sore when I do that, especially the right side. But just a little bit of bruising left under the eye. Still extremely tight under here, all over here. At night I still can't lay on my ears. They're still a little swollen and still uncomfortable. But if I take the hydrocodone, it eases the pain up so that I can lay on it more than I can when I'm not taking pain meds. So anyway, that's 1 week after surgery. Not too bad.
Today is July 31st, 2020. This is 6 weeks post-op, and I wanted to do this video and show you a little bit more with the healing process. Of course, I have makeup on. The scars are, they're healing. They're still a little red. Still a little red behind my ears, but that feels so much better. This side, I just have a little bit of bruising right here still, and a little red. The only irritation that I feel is if I'm outside and it gets hot and I'm sweaty. It kind of stings a little bit, all these incisions back here and around my ears, but it's not, anything horrible. The incision under my chin, the sutures, they left those in because they said those were dissolvable. But you can see there's still, or if you can see, there's still some bumpiness. But I do have redness still on my neck and face. That does get covered up really well. If you have a good concealer or foundation, you can cover that up, no problem. The incisions around my eye, I know you can't see probably because I have concealer on, but there's a little red mark right there. But those incision sites can be hidden very well with concealer and some eye makeup. So pretty much most of the swelling is gone except for a little right here. I still feel numb in certain areas, but the tightness that I was feeling like I had a mud mask on, a lot of that is gone. It was so tight right in here. And it wasn't extremely uncomfortable, but if you're a person that has a phobia about having your face really tight, you might not like that. But it has relaxed a lot. I don't feel like I have a mud mask on. Now when I stretch my jaw, it's still a little tight right here, which is fine. It doesn't keep me from eating or talking or anything. I can sleep on my side now. I started being able to sleep on my side, I guess, a week ago. Because the incision sites take a while to heal, and the soreness, it's not comfortable trying to sleep on your side, but now I can. I had some people ask questions. I posted a review on realself.com and asked me some questions, so I'm going to try to answer those here just in case anybody has questions about that. They did ask what type of procedure I had, and I swear I do not remember. I'm going to see the doctor next week, so I'll find out and post another video. While I'm thinking about what questions they asked me, I will tell you I use Derma E Scar Gel. Don't know if you can see that. Derma E Scar Gel. It looks just like aloe vera. It's clear. And you just put it on your incision sites. It helps reduce redness. It helps reduce swelling. I had a tummy tuck 11 years ago by the same doctor, and I used the Derma E Scar Gel, and it took all the redness away and the swelling, so I'm very pleased with that product. I do clean my face with the Walmart brand of Dermasil. It's cheaper, so I have cleaned my face with that. But normally what I like to use is True Science, which you can purchase that from a distributor for Life Vantage. This is anti-aging products. I use the facial cleanser, the toner, and I also use the lotion, which helps reduce cancer on your skin. And like I said, it's an anti-aging lotion. I'm out of that. So right now I'm using this, I guess it's called Andalou Naturals. It's a tinted moisturizer and it has sunscreen in it. I actually like this as a foundation because it seems to go on smoother and I don't have so many lines like you get sometimes with foundation. And I noticed some of the other foundations I would put on, and like around here, a lot of my skin would start exfoliating. I don't know if that was just drying out my skin or what, but I really like that one. So it's important to keep your face cleaned and moisturized. I turned 60 this year, and that was my birthday present to myself, was to get a facelift. I was tired of the wrinkles right here. I had lost a little over 30 pounds probably 6 years ago, and
noticed probably 3 years ago that I was getting a lot of wrinkles right here, and then here, and then the jowl area. If you look at my before pictures, when I looked down, it was worse. Of course, everything just came forward, and I had a lot of folds. And just even looking at myself in the mirror, when I looked down, I was like, oh my gosh, I look like I'm 80 years old, and I didn't like that. I did not have anything done to my eyebrows, to the upper eye, no work at all. Of course, the incisions over here come up to about here, so that still didn't pull anything up, but one eyebrow is up a little bit higher than this one. I did have microblading done in November of last year, and she did not do this eyebrow the same as she did that one. And anyway, that's another story. But so sometimes in my pictures, this one looks higher up. The surgery he did for my lower lids, I know that he told me that there was a ligament that had come down, and that he would pull this back up. I don't know exactly how he did that or the details. I'll find out next week when I ask him. And I don't believe he did a SMOS type facelift on me, because I asked him that. He said he wasn't doing that. He doesn't do the go down deep into the muscle. He just works with the fascia. So I'm not sure what type of facelift that's called. Did have the lower neck lift, of course. So I am very happy, very pleased with the facelift, and any pain that I had to endure, which really was not that much. Like I said, getting the drains taken out was the most painful thing of anything, and you can avoid that, I think, by putting ice packs right here on your way to your doctor's visit, making sure that it's nice and numb, and take your pain meds, and just maybe see if you can hold the ice pack on there while they take it off. I don't know, but that really helped. And it just hurts for a second, but I swear the pain is like, oh my gosh, even for a couple of seconds, it's like, was not pleasant. And of course, if somebody hits your face or you accidentally, bump your face or whatever, that's gonna hurt. But I don't feel pain, like constant pain where the incision sites are, the bruising or nothing. I don't feel constant pain. Just, the irritation in my eyes for like the first 3 days. And just keep your eyes moisturized if you're having work done on your lower lid. What else did they ask? I didn't have any fillers. I don't like doing that. I didn't have any other microdermabrasion or lasers treatment on my face. It was just a facelift. He said I did not need all that other stuff, but so anyway, yes, I feel like I look younger. I'm very happy with it. I'm happy with how I look when I don't have makeup on, and I did not feel that way before. I felt like I looked my age, and I didn't like that. So anyway, my doctor, my surgeon was Paul Feldman, and he is at Advanced Aesthetics in Fayetteville, Georgia. And I highly recommend him. He did a great job on my tummy tuck, and he did an excellent job on my facelift. So if you have any questions, please post in the comments, and I will get back to you as soon as I can.
So the two videos that you're about to watch are of me at Dr. Feldman's office early this morning. I was not able to go in and do a video with him at the 3-month mark. I think they wanted me to come in. Our schedules did not coincide with each other. I wasn't able to get in until February of 2021. So it's been almost 8 months since my surgery. So hope you enjoy. He does a lot of explaining in these next two videos about what he did and why he put incisions here in front of the hairline instead of into the hairline. He explains that. I did have a SMOS facelift, but he did it a little different, and so I will let him explain that in the next couple of videos. Hope you enjoy.
Hello, I'm Dr. Paul Feldman. I'm here with Deborah, one of my patients from June of 2020. where we did a facelift, lower eyelid left, and a KZ wedge on the lower eyelid. I think here she has had a wonderful result, and she asked me to explain to everybody what exactly we did. If you just look at her, I think she has a very natural result. I think it's because of her mid-face here is natural as well. When she first came to me, her lower eyelid was elongated, and the mid-face was descended. One of the things that we do with the technique is that I make my incisions, let me have you turn your head just a little bit, is I make my incision in front of the hairline here, and it comes around the sideburn and then around the ear here. I do not make my incision inside the hairline. So a lot of people ask me why that is. When we make the incision inside the hairline, it's easy to hide the scar. But what it does is it pulls the hairline back, and it makes it into, you can get a stigmata or an abnormal appearance because your hairline's receding, and you can see more visible skin there. But it also does not allow me to do the mid-face. By putting the incision in front of the hairline, I'm able to really give her a free mid-face lift. And what that really means is that I'm able to get to this area here, where I'm able to put a deep suture from here to the ligament underneath the mid-face area here and lift up. When I lift that up, I'm able to lift up the inferior border, the bottom border of the lower eyelid, and then bring it to an area, to a level where it's just right at the orbital rim. And that's where anatomically it should be. The other thing is that what I do more times than not is I take out a little bit of a wedge of lower eyelid skin to tighten it up. As we age, we get some excess skin to the lower eyelid in the horizontal direction. Some of the other procedures try to do a canthoplasty, which is a fancy word, to tighten up the edge of the eyelid here, but sometimes it can distort that. When I put the incision here, it's virtually invisible, and there's no distortion to the lower eyelid. And a lot of times people think that it changes your appearance drastically by changing that corner. So I think those are what we did to the mid-face. And if you have a nice mid-face, you have a nice result. Typically a facelift is easy to tighten you here on the side plane, but if this front plane here is not tightened accordingly, then you get just a more pulled look rather than a natural look. Hello, I'm Dr. Paul Feldman. I'm here with Deborah, one of my patients, where we did a facelift back in June of 2020. I just want to say right now I'm not wearing a mask. I had my 2 vaccinations. I usually do wear a mask during all other patient encounters, but for artistic license, we're going to forego the mask for this time. So if you look at Deborah, she has a very natural result with her facelift, and we just previously talked about how we treat the mid-face and why we make the incision in front of the hairline. The other thing I'd like to talk about is that how we actually treat the deep layer, the SMAS, S-M-A-S. It's an acronym for a long name, but it's just basically that fascial layer underneath the skin that helps give a more long-lasting pull. There's multiple ways to actually handle that, and in all plastic surgeries there are many controversies about how to do this. I personally like the technique where I imbricate it. Imbrication is a fancy word to actually fold it up or make it sort of like an accordion. Well, underneath the SMAS layer is the facial nerve. That's the nerve that actually innervates the face and causes movement, so like your smile and things like that. So we don't want to have any injury to that. And by not lifting up the SMAS and pulling it, but by putting sutures in it where we can imbricate it or fold it up or pleat it, we're able to get a very natural pull with more safety, with less risk of injury to the facial nerve. And basically this comes down to placing 3 sutures. One will be a U-shaped suture that goes across here that helps lift up. The next one's an O-shaped suture that pulls back this way. And my favorite suture is the M suture, where it put here and grab onto a ligament here, mid-face ligament, and I'm able to elevate the mid-face. So those are the 3 sutures that we use for this mask technique, and the take-home message is that I think it's safer in terms of the facial nerve.
I hope you enjoyed my video. I hope it gives you a better understanding of what to expect from a facelift and what type of surgeon you might want to look for. Again, my surgeon is Dr. Paul Feldman at Advanced Aesthetics in Fayetteville, Georgia. I know they have another location in Atlanta as well, but he's the surgeon that I went to for my facelift and for my tummy tuck back in 2009. He did an excellent job. I've never had any issues, never had any problems whatsoever with my tummy tuck or my facelift so far. Everything's been great. I've been very happy. Please feel free to share this video, give it a thumbs up if you like it, and good luck with your journey.